All right, let's jump right in, shall we? Today we're going deep into a fascinating area, videourodynamics.
Yeah, it's pretty wild. We're basically talking about giving your bladder its own X-ray movie. We can see it filling, emptying, the whole
It's
thing.
like getting a backstage pass to a system we usually don't get to see.
Right, exactly.
Now, officially, it's called Videourodynamics, or VUDS for short. Basically, it combines traditional urodynamics with fluoroscopy, which I know sounds like something out of Star Trek.
Kinda, yeah.
But really, it's just a continuous X-ray so we can see your bladder in action.
Yeah.
We've got some great research guiding us today. The International Continence Society guidelines, the AUA and SEFU guidelines, and a really cool review from Nature Reviews Urology all about VUDS.
The takeaway here is that VUDS helps us figure out what's going on in your lower urinary tract, especially when things get tricky, or when other tests haven't given us a clear answer.
Like, it's the next level of investigation.
Exactly.
So it's more than just numbers on a screen.
Oh, yeah, it's way more dynamic. We're literally seeing how your bladder functions.
Okay, so walk us through the basics. What are the main components of this procedure?
So VUDS has two main parts. First, you've got the urodynamics, which uses catheters and sensors to measure pressure and flow, inside your bladder and urethra.
That's one half of the equation.
Right. And then you've got the fluoroscopy that's giving us those X-ray images, showing us what your bladder and urethra actually look like and how they're moving.
So you get the measurements and the visuals.
Exactly. It's about connecting those dots.
Now, I read that VUDS has been around for a while.
Oh, yeah, way longer than you might think. The first time someone synced urodynamics with this type of imaging, it was back in 1964.
Wow, that's a long time ago.
It is. Of course, back then, they were really just focusing on the urethra and the bladder neck. But technology has come a long way since then. And, it's become much more common in the U.S. We're seeing 5 to 9 times more VUDS procedures being done compared to, like, a decade ago.
Wow. So let's talk about the contrast fluid that's used.
Right, so for the X-ray to see anything, we need to fill your bladder with this special contrast fluid. Usually it's iodine-based.
Right, because you need something for the X-ray to pick up.
Exactly, and, because it's different from the sterile water or saline they usually use in urodynamics, we have to make sure the equipment is calibrated correctly.
Oh, that's interesting. I hadn't thought about that. So when is VUDS actually recommended? Is this something everyone with bladder problems needs to have?
Well, not necessarily. VDS is a powerful tool, but it's not always the first line of defense. It's particularly helpful when the standard tests aren't giving us a clear picture.
So it's like when you need to bring in the specialists.
Exactly. Like getting a second opinion from an expert.
Makes sense. So what are some situations where VUDS is really essential?
Well, there are some well-established indications where VUDS is considered the gold standard. Like, one of the most important is neurogenic lower urinary tract dysfunction.
Okay, for those of us who aren't doctors, break that down.
Sure, think of it this way. NLUTD is when neurological conditions like multiple sclerosis or spinal cord injuries start affecting your bladder control.
Right, because your nervous system plays a big role in bladder function.
Exactly. And VUDS is critical in these cases because it can help us pinpoint the specific type of dysfunction, which is really important for protecting the kidneys.
Oh, so it can actually help prevent further damage.
Yes, exactly. And here's another reason VUDS is so important in NLUTD. It can detect something called vesicoureteral reflux, VUR for short.
VUR.
Yeah. This is when urine flows back up into the kidneys, which can be really serious. And traditional urodynamics might miss this.
So it's catching something that other tests might not.
Exactly. It's like having a more sensitive radar.
Okay, so NLUTD, that's one big one. What else?
Another important indication is bladder outlet obstruction, or BO, especially in women.
Right, I've heard BO can be tricky to diagnose in women. Why is that?
Well, the symptoms can mimic other conditions, and the standard tests don't always tell the whole story. But VUDS can help us distinguish between anatomical BU, which is like a physical blockage,
Okay.
and functional BU, which is more of a muscle or nerve issue.
So it's about seeing what's actually happening, rather than just relying on the symptoms.
Exactly. In fact, VUDS can even uncover a condition called bladder neck dyssynergia. That's where the bladder and sphincter muscles aren't coordinating properly.
Oh, wow.
Yeah, and that's something traditional urodynamics might miss completely.
So VDS is giving you a much more detailed picture.
Exactly. It's like zooming in with a high-powered lens.
Okay, so we've got NLUTD, BUO in women. Are there any other situations where VDS is commonly used?
Yeah, definitely. Another one is for people who are born with congenital genitourinary abnormalities. or if they've had surgical reconstruction of their urinary tract.
So it's like a way to monitor how things are functioning after surgery.
Exactly. It helps us see how things are working in the long term.
Makes sense. Are there any areas where VUDS is being explored, even if it's not yet standard practice?
Oh, yeah, absolutely. There's a lot of research going on. Like, there are some emerging indications that look really promising. Recurrent UTIs in women, chronic bladder pain syndrome, even cases where doctors need more info before deciding on a treatment. It's a really exciting area.
So there's a lot of potential for VUDS to help even more people in the future.
Definitely. We're just scratching the surface, I think.
It sounds like VUDS can be a real game changer for folks who are dealing with complex bladder issues.
Oh, absolutely. It can make a huge difference.
But like with any procedure, I'm guessing there's some limitations to consider.
Yeah, you're right. VUDS isn't a perfect solution. One of the main challenges is what we call the voiding on demand issue.
Meaning,
Well, with VUDS, you're hooked up to all this equipment, there's an x-ray machine. It's not exactly your normal bathroom environment.
right, it sounds a little intimidating.
It can be for some people. And, that unusual setting plus the nerves that often come with medical procedures,
Yeah.
it can make it hard to relax and void naturally. And that can sometimes affect the accuracy of the results.
Okay, that makes sense. What about radiation exposure? I know that's always a concern with x-rays.
Yeah, that's a valid concern for sure. But it's important to remember that the doses used in VUDS are generally low. Studies have shown a mean effective dose of 0.34 millisVA, which is really minimal.
Okay, so the risk is there, but it's relatively low.
Yeah. And there are things we can do to minimize exposure even further. We use low-dose fluoroscopy, pulsed imaging.
Right.
We only take images at key moments rather
Yeah.
than continuous imaging. And of course, everyone in the room wears protective gear.
Right, so lots of safety measures in place.
Absolutely.
So we've got the voiding on demand challenge, radiation exposure. Any other limitations to keep in mind?
Cost and availability are definitely factors. VUDS requires specialized equipment and expertise, which means it can be more expensive than traditional urodynamics, and it might not be available everywhere.
Right, so access can be an issue.
Yeah, unfortunately.
Okay, so let's recap. VUDS combines urodynamics and fluoroscopy to create this really detailed map of your bladder's activity.
Yeah, it's like getting a behind-the-scenes tour of your bladder.
Exactly. We've talked about the situations where VUDS is especially helpful, like NOUTD, BUO, and congenital or surgical cases.
Right.
But it does have some limitations, like the voiding on demand challenge, radiation exposure, and the issues with cost and availability.
But for people who are really struggling with complex bladder problems, VUDS can be a game changer. It can give us insights and potential solutions that we just wouldn't get from other tests.
So it's definitely worth discussing with your doctor if you think it might be right for you.
Absolutely.
All right, well, that was a great overview of videodynamics. Thanks for breaking it down for us.
My pleasure.
Stay tuned for the next part of our deep dive, where we'll walk you through the actual VUDS procedure itself, what happens when you go in for the test, what the doctors are looking for, and all that good stuff.
It's going to be fascinating.
It is. So until next time, thanks for listening.
See you then. It's like seeing your bladder in high definition.
Okay, so we've talked about what VUDS is and when it's used, but let's walk through the actual procedure now. What can someone expect if they have to go in for this test?
All right, so the first thing is we'll get you all set up with the urodynamics equipment, making sure everything's calibrated and following the International Continence Society guidelines. We want to be sure we're getting accurate readings. Then we'll place catheters, one in your bladder and one in your rectum to measure the pressures. And then comes the fun part. We'll fill your bladder up with that contrast fluid we were talking about earlier.
Right, the stuff that makes everything visible on the X-ray.
Exactly. So once you're all prepped and ready to go, the fluoroscopy machine comes into play. It kind of looks like a big C-shaped arm. It's carefully positioned to target the area we're interested in so we can minimize the radiation exposure as much as possible.
I was going to ask about that. Is there a lot of radiation involved?
It's something we're always mindful of. Everyone in the room will be wearing protective gear, and we use the lowest possible dose to get the images we need.
That's good to know. So you're saying it's not continuous radiation?
Right. We don't need to be taking pictures the whole time. We're really focusing on specific moments or maneuvers, when something interesting is happening.
So it's more like targeted snapshots.
Exactly. And those snapshots are taken at very specific points. Like, for example, if we're evaluating for stress incontinence, we'll take images while you're coughing or straining, or during the voiding phase when you're actually peeing, we'll be focusing on the bladder neck and urethra, especially if we suspect there might be a blockage.
So it's really about capturing those key moments when something might be going wrong.
Right.
Precisely. And then after the procedure's finished, we'll take one last image to make sure your bladder's completely empty, to check for any residual contrast.
Makes sense. So we've talked about the setup, the contrast fluid, and the images themselves. Now, what about the interpretation? What are the doctors actually looking for when they analyze those x-rays?
Well, that's where the expertise really comes in. It's not just about seeing the images, it's about understanding what they mean in the context of your overall bladder function and your symptoms.
So like being a detective, looking for clues.
Exactly. It's like putting together a puzzle using both the visual clues from the images and the data from the urodynamic measurements.
So let's talk about some of those clues. What might a doctor see in these images?
Well, sometimes the clues start appearing even before the study officially begins. Like the initial scout images, those are just taken to make sure you're positioned correctly. Sometimes they'll reveal things like bladder stones or ureteral stents. Or we might even see things outside the urinary tract like orthopedic hardware or clips from previous surgeries. Wow, so you can get a glimpse into other areas as well.
You never know what you might find. Then, during the bladder filling phase, we're really looking at the bladder's shape and size. We might see something called trabeculation, which is when the bladder wall thickens and gets kind of bumpy.
Bumpy bladder. Doesn't sound good.
It can be a sign that the bladder's been working too hard to empty, maybe because of an obstruction or a weak bladder muscle. We also check the bladder's position to rule out things like cystosol, where the bladder drops down into the vagina.
So it's like a full inspection of the bladder's anatomy.
Exactly. We're looking for anything out of the ordinary. And then, of course, we pay close attention to the bladder neck to make sure it's closing properly. If it's not, that can lead to leakage. And we'll be examining the ureters, too. Those are the tubes that connect the kidneys to the bladder. We're looking for signs of VUR or any congenital abnormalities.
So it's a comprehensive view of the whole system.
Right, from the kidneys all the way down to the urethra. And then during the voiding phase, we shift our focus to the bladder neck and urethra, especially when we suspect BU. Normally, the bladder neck should open up nicely when you urinate, but if there is an obstruction, that process gets disrupted.
And I imagine VUDS can show you exactly where the blockage is.
Absolutely. We can see if there's a tight bladder neck or if the obstruction is further down in the urethra, maybe from a stricture or scar tissue. It helps us pinpoint the problem area so we can tailor the treatment accordingly.
That makes sense. So we've talked about what you might see in the images, but what do those findings actually mean for the patient?
Well, that's the million-dollar question, isn't it? And the answer, as always, is it depends. The significance of the findings really varies from person to person. It depends on your symptoms, your medical history, your overall health.
So there's no one-size-fits-all interpretation.
Right. Every case is unique. But let's say you have NLUTD. One of the most concerning findings would be that vesicoruteral reflux, the VUR we talked about.
Right, where urine flows back up to the kidneys.
Exactly. That's a red flag because it can lead to infections and even kidney damage. So catching it early is really important.
So VUDS can be life-saving in those cases.
Potentially, yes. And with BO, if we see a severe obstruction that's causing you a lot of trouble, making it really difficult to pee or even leading to urinary retention, that's also a serious issue.
So it's about understanding the severity of the problem.
Exactly. The type and severity of the obstruction will determine the best treatment plan. Whether it's medication or a procedure or even surgery in some cases.
So VUDS is giving you a roadmap to better bladder health.
That's a great way to put it. It's about getting to the root of the problem so we can provide the most effective treatment.
All right, so to wrap up this part of our deep dive, VUDS is like a powerful lens that lets doctors see the inner workings of your bladder in incredible detail. It's about moving beyond guesswork and getting concrete answers.
And those answers can make a real difference in your quality of life.
Absolutely. So stay tuned for the final part of our deep dive, where we'll wrap up with some key takeaways and leave you with some food for thought. All right, so we've really gone deep into videourodynamics, haven't we?
Yeah, we've covered a lot of ground.
From the basics to the really detailed stuff.
It's been a journey.
But before we finish up, I want to make sure we've got those key takeaways for our listeners. We've said that VUDS is really powerful, but it's not always the first step, right?
Yeah, that's important to remember. Even though it's the gold standard for some conditions, it's not the go-to test for every bladder problem. If you're having mild symptoms, your doctor would probably start with something simpler, like a urinalysis or a uroflowmetry test.
So it's not like you'd automatically jump to VUDS if you had a few leaks here and there.
No, not at all. VUDS is usually for those more complicated cases, or when those simpler tests don't give us enough info.
It's like you need to bring in the big guns.
Exactly. You need that specialized look.
And speaking of specialized, you need a specialist to interpret the findings too, right?
Oh, absolutely. It's not just about looking at the images. It's about putting all the pieces together. The symptoms, the medical history, the measurements, the images. It's like solving a puzzle.
So you need a urologist who really knows their stuff when it comes to VUDS.
Definitely. Someone who's comfortable with the procedure and can explain everything to you in a way that makes sense.
Right, because it can get pretty technical.
It can, and they'll be able to work with you to figure out the best treatment plan for your specific needs.
So finding the right doctor is key.
Absolutely. They're your partner in this whole process.
Okay, so we've broken down video dynamics. We've looked at what it is, when it's used, and why it matters. But we always like to leave our listeners with something to think about. Something to keep the conversation going. What's our thought-provoking question for today?
Well, we've talked about how valuable VUDS can be, but we've also talked about the limitations, right? The cost, the availability. So I think the question is, how can we make this procedure more accessible and patient-friendly?
It's a great question. If it can really help people, shouldn't everyone who needs it be able to get it?
Exactly. And I think as technology keeps advancing, we need to explore new possibilities. Like, how could artificial intelligence play a role? Maybe AI could help streamline the interpretation, make it more efficient.
That's really interesting. So there's potential for even more progress in the future.
Definitely. I think we're just at the beginning.
Okay, well, I think we've given everyone a solid understanding of VUDS and why it's so important.
We've covered a lot of ground.
And hopefully this knowledge will help you advocate for your own health and have those informed conversations with your doctors.
It's all about being empowered.
Exactly. All right, well, thanks for joining us on this deep dive into video dynamics.
It's been a pleasure.
Until next time.